Hey, General, just heads up. I'll have a crew coming to you with approximately 72-year-old female post-cardiac arrest. Sounds like it was witnessed, CPR started by family.
You were coming with a conscious and alert 65-year-old female complaining of 9 out of 10 left lower quadrant abdominal pain radiating into the right lower quadrant as well as into the lower back. She did have a gastroscopy and colonoscopy last week, having some nausea, vomiting, diarrhea with blood in it since then. We did some ECGs, just sinus rhythm with some PVCs. We have a line started. We're giving some fluids, getting some pain management going. She's vitally stable, and we will be there in about 5 minutes.
Hey, coming in with a conscious and alert, 75 female, COPD exacerbation this morning. ILI symptoms over the last 3 days on our arrival. Not really moving much air. SpO2 was 65% on the room air. 2 rounds of NEBs, magnesium, sodium medrol. Now SpO2 is 91% on 8 liters. She's AFib on the monitor with that near history at about 150 right now. 160 over 80 is her blood pressure. Rest rate currently 40. End tidal is 46. Better air entry now. Still some wheezing. That's auscultated throughout. We've got an IV established, and we'll see in about 10 minutes.
General, en route with our consular 76-year-old female coming from Los Angeles. They had an acute change in saturation this morning, starting at 75% on room air. No known history of pain for patient. Right now, it's starting at 96% on 15 liters. Any titration, patient will destat. Deny shortness of breath. Lung sounds are clear post-NEB. 12 lead just shows a flutter with ST depression in 1 AVL V4 through V6. Otherwise, patients resting comfortably. Chems 8.3. Pressure's 133 on 80. We'll see in about 5. Screen's positive.
Hey there, runner with a 20-year-old consular female complaining of abdominal pain for approximately last week, worsening this morning. Rates at 7 out of 10 to her upper abdomen. Vitally, she's completely stable. We treat with some Zolvan for the nausea, and we'll see in approximately 5 to 10 minutes.
General, en route with a consular 55-year-old male. Sudden onset of dizziness today, post-fasting blood work. Right now, patient is nauseated, vomiting. Just going to treat with some Zofran. 12 lead shows normal sinus with ST depression in 2, 3 AVS and V2 through V6. Blood sugar is 9.3. Pressure of 133 on 76. Screen's negative. We'll see in about 5.
Hey, General, reciprocation 24, conscious alert male, ILI negative. It's at 2.5 days of low quadrant abdominal pain, increases with palpation into the bladder area, frequent urination, no nausea, vomiting, ambulatory.
Hey, we are coming with a conscious and alert but very confused 99-year-old female that's been complaining of general body pain all over for about a week. She is unable to really describe the pain or rate the pain. She has had a decreased PO intake due to the pain. She is vitally stable, a little hypertensive at like 190 on 100. We are unable to get a line, and we will be there in about 5 minutes.
They're on route with a 19-year-old conscious alert female patient complaining of some lower abdomen plating and some blood in her urine, as well as a constant sensation to void in the last 2 hours. Finally, she completely stable at this time. We treated with some naproxen. We'll see in approximately 5 minutes.
I'm with a conscious alert 73 male from convalescent unit. It's a precinct episode today. When they did their vitals, 70 systolic, pulse of 50. Now, sinus on the monitor, first 3 block at 60, blood pressure is 100 on 60 after 300 of saline. And otherwise vitally stable now. We'll see in about 3 minutes.
NRG with a 61 male conscious alert coming from local care home. Calls for some shortness of breath. On arrival, stats of 65 on room air. With us, he's on an NRB at 15 liters per minute. Unable to titrate him down because he'll desat on us. Other vitals are stable. Lung sounds are clear and equal. We're C1 as well, and we're about 15 minutes out.
Hey, we're coming with a conscious and alert 94-year-old female that is having multiple falls recently, 2 today. No injuries, was quite weak, unable to transfer by herself anymore. We did find that her lungs were diminished air entry on the left, middle, and down to the lower. No shortness of breath with that. And then just recently complaining of some tense cramping in the left side of her neck. We've given some Tylenol for that. She's vitally stable, and we will be there in about 5 minutes.